Welcome back to the Best PT Podcast. This is episode 12, talking about nutrition. This is the last episode in the Other Systems category if you're trying to follow along with a study book. Let's start with talking about fat-soluble vitamins, vitamins A, D, E, and K. Vitamin A is essential for eyeballs, epithelial tissue, normal development, and reproduction. Vitamin A toxicity can cause appetite loss, hair loss, and enlarged liver or spleen. Vitamin D increases blood levels of calcium and phosphorus. Vitamin D toxicity can cause calcification of soft tissue or hypercalcemia. Vitamin E is important for cells exposed to high levels of oxygen. Toxicity includes decreased thyroid hormones and an increased triglyceride count. And finally, vitamin K is important for clotting. Currently, it has no toxicity levels. Water-soluble vitamins, the B vitamins, biotin, choline, folic acid, and pantothenic acid. Vitamin B12 or riboflavin facilitates the enzyme action in food metabolism with no current known toxicity. Vitamin B3 or niacin regulates energy metabolism. Toxicity involves abnormal glucose metabolism, nausea, vomiting, and gastric ulcers. Vitamin B6 is involved in the metabolism of food. Toxicity can include sensory damage, extremity paresthesia, and ataxia. Vitamin B12 aids in hemoglobin synthesis. No toxicity. Vitamin C combats infections and facilitates wound healing. Toxicity involves bladder stones, diarrhea, and hypoglycemia. Biotin is involved in the facilitation of many enzymes with no toxicity. Choline is necessary for nerve function and lipid metabolism with no toxicity. Folacin or folic acid is involved in the formation of red blood cells and GI tract function. No toxicity. And pantothenic acid is the component in many complex enzymes and the metabolism of fatty acids. The toxicity here involves diarrhea. Major and trace minerals. Major minerals. Calcium facilitates muscle contraction and relaxation, strong bones and teeth, and aids in coagulation. Toxicity involves kidney stones. Chloride maintains fluid and acid-base balance. No toxicity. Magnesium is involved with strong bones and teeth, activation of enzymes, and regulation of heartbeat. Toxicity involves increased calcium excretion. Phosphorus strengthens bones, oxidizes fats and carbs, and is involved in acid-base balance. Toxicity involves muscle spasms. Potassium maintains fluid and acid-base balance. Toxicity can involve hyperkalemia and cardiac disturbances. And finally, for major minerals, sodium maintains our acid-base balance, facilitates nerve impulses as well as muscular contractions. No toxicity. Trace minerals. Chromium controls glucose metabolism. Toxicity involves liver damage. Cobalt is a component of vitamin B12. It also helps activate enzymes. Toxicity is polycythemia or too many red blood cells, as well as increased blood volume. Copper facilitates hemoglobin synthesis and lipid metabolism. Toxicity involves Wilson's disease or the inability to excrete copper. Fluorine is involved in the formation of bones and teeth and osteoporosis prevention. Toxicity is fluorosis or mottled tooth enamel. Iodine is involved in the regulation of cell metabolism and basal metabolic rate. No toxicity. Iron is involved in oxygen transport and cell oxidation through the creation of hemoglobin molecules. Toxicity is hemochromatosis involving liver and kidney damage. Manganese is involved with proper bone structure and is a component of enzymes. No toxicity. Selenium is a synergistic vitamin with vitamin E. Toxicity, fingernail or toenail defects, nausea and abdominal pain. Molybdenum, a component of enzymes necessary for cellular function. No toxicity. And finally, zinc, which aids in immune function. Toxicity here involves anemia, nausea, and vomiting. That's it for episode 12, dealing with nutrition. This was the last episode in the Other Systems category and the last episode in the Body Systems total. If you've been following me since the beginning, we are now through 87.5% of the NPTE material. Material for here on out will be very short and brief, involving things like bed mobility, transfers, wheelchair fitting, assistive devices, medical equipment, way too much about modalities, ergonomics, infection control, PT ethical code, disability models, PT practice standards, health insurance, patient education, and a little bit about research and evidence-based practice. The next episode will be episode 13, talking about bed mobility and transfers. As always, the outline will be in the show notes. Thanks for joining.